This is a 19-minute presentation for the greatest understanding. Be certain to watch it from beginning until end. This video is meant to demonstrate the detailed construction of an overlay utility arch wire for the mandibular dentition. Here you can see the 1622 utility overlay, and the base arch on the lower is an 020 night null or TMA wire. Details of construction, the overlay utility. Here is the 1622 stainless steel arch blank, which I've removed from a package and sized it. Now I'm going to hold it with the midlines in line, the midline on the arch wire, and then using an arch marker, in this case a crayon, I'm going to mark the wire right at the mesial of the tube, and I'm going to do that on each side because that's where I'm going to put the bend. So intraorally, you'll recall when you're making these marks, the wire must be dry. If saliva gets on the wire, then when you take the wire out of the mouth, the mark will move. See that mark? I'll grab the wire on the mark, 90 degrees to the plier, 90 degrees, bend up and flare slightly in, overdo it, and then finish the bend by pushing against the wire and the plier at the same time, exaggerating so I have a bit of a Z shape to it. Trying to make this as clear as possible, let me do that bend again. For the overlay utility, notice I'm holding the wire at 90 degrees, and then I'm going to make the bend at 90 degrees and then exaggerate it. So there it is initially, and here it is, simple exaggeration, sometimes called a Z bend. To activate the wire, once it is placed, this is going to be activated intraorally, I will place the barrel of the plier. The barrel will be apical, like this, and held at 90 degrees. And then when I squeeze the plier, it will cause the angle of entry to change like this. That's all going to be done intraorally, which I will demonstrate on a Typodon. Notice that the plier has a barrel as well as a cradle. So the barrel is the round part and the cradle is what it fits into. Here's the wire at rest from an anterior view. Again, that is not enough force in the system to cause the treatment response that I'm after. Now, in order to tie the overlay in the midline, I'm going to take a piece of 010 cut steel tie, and you can see what I've done by looping the 010 ligature underneath the overlay utility and also underneath the base arch. Now it's just a simple matter of cinching this up so that I can activate the wire. This is an ideal position, or very close to it, of the overlay utility being essentially on top or just below the bracket slot and then cinched down with a mathau. Cutting off the excess, voila. And then I've used a ligature director to aggressively curl that stainless steel pigtail up and underneath the base arch so that it can't unroll and stick the patient and cause an emergency like this. So you can see how I've tucked the stainless steel ligature securing the overlay utility. You'll also notice that on the 020 night null base arch that everything was tied together before I started. This helps avoid any spaces that could occur during the intrusion, which could alarm the patient. which is done intraorally of the overlay utility, is by grabbing the wire, grabbing the overlay with the barrel pointed apically, pulling out slightly, and then squeezing basically all the way, and you see that sway in the wire. That tells me that it's active. And if you compare the sides right and left, you can see this side is straighter, this side has this activation curve in it. You're activating both sides equally. So you can see that the curve in the wire looks very similar on both sides, tied at the midline. Now, because it's tied at the midline, even if one side is somewhat more active than the other, with the stout 020 nitinol base arch, as well as being tied in the midline, you should not see any asymmetric intrusion. Trying to make this as clear as possible, let me do that bend again for the overlay utility. Notice I'm holding the wire at 90 degrees, and then I'm going to make the bend at 90 degrees and then exaggerate it. So there it is initially, and here it is, simple exaggeration, sometimes called a Z-bend. This is how it looks when it was activated. So the activation, in order to cause the intrusion, overbite correction, and extrusion of the posterior, that is actually done with the barrel and cradle right as far close to this bend as possible. There is the barrel of the plier, and the cradle would be here. And that will cause the 90-degree bend. Let me show you that again. So here is the modified loop plier. Here is a mark on my thumb from the marker. Barrel is going to point apically. I'm going to grab a hold of the wire far into the bend, and then as I squeeze, you can see that it causes the typical shape that I showed you. That will be like this, barrel and cradle. Now, instead of being passive or relatively passive when the wire is inserted into the utility tube, you will notice that the wire is now laying well below the anterior teeth. So when the wire is engaged, it will do this in the anterior, causing an intrusion of the entire arch and an extrusion of the posterior. So there's an intrusion in the anterior and an extrusion in the posterior. So this will be loaded and unloaded, loaded and unloaded. Now if you notice, the wire will be entering the tube in the back. Of course, this will be distal end cut in the typodont, but you will notice that as the wire is deflected into the maxillary anteriors and tied in the midline, you'll notice it will have a rather dramatic effect on the lower molar. In order for you to easily visualize this, I'm going to outline the lower molar. Little secondary anatomy here. This would be the position of the molar at rest, or at time 1. With the wire placed into the utility tube of the first molar, in the passive position, this is what it will look like, or the unloaded position of the wire. But remember, it's going to be tied in the midline, which is going to cause what at the first molar? Well, let's just see. This is what will happen at the first molar. Watch what I'm doing is I'm going to tie it in the midline, and the angle of entry is now going to cause a substantial distal crown rotation. A substantial distal crown rotation. So with the schematic, you can see here, as I lift up the wire to engage it in the midline, it is going to cause a substantial moment of couple, causing a distal crown rotation from here to here. Time 1, unloaded, and as the system works, there will be a significant distal crown rotation of the first molar. However, in the overlay utility setup, there will be a O2O nitinol or TMA base arch that will run through the entire system. Therefore, as the crown attempts to rotate distally from the overlay utility, this rather stout O2O nitinol wire is going to stop the molar from rotating distally. It's going to cause what's called a subtractive force. So as the molar tries to rotate distally, the tube in the main arch tube locks on the O2O base arch and effectively stops the molar from rotating distally except for a very slight amount. Now let's take a look at that again. In a rest position, this is how the overlay is going to look. The overlay utility in the utility arch tube, but it will be tied in the midline, causing an intrusion and Newton's third law, an extrusion. Again, watch how the angle of entry would change, and as just described, the stout O2O TMA or nitinol base arch, that's the blue wire, would tend to control that. So you can see from here, if the wire is tied in the midline, there's going to be a significant amount of intrusion, Maybe I should do that with a more festive and obvious. There's going to be an intrusion, and therefore, what else will have to happen? An extrusion. So the entire plane, the entire slot line or occlusal plane of the lower will be tilted or tipped in this direction. Base arch, and here is what is going to happen as the molar tips back. So you're going to have a molar crown tip back, a moment of couple that is going to be significant in that area. Molar crown tip back, rotation forward from the moment of couple of the overlay utility. The crown tip back will be subtractive or controlled by the base arch, tending to nullify some of this until the wire locks on the tube. We will also have an intrusion and an extrusion. Well, if one imagines that the posterior is extruding, it won't just go occlusally, it will also tend to rotate or tip lingually. Therefore, the overlay utility is expanded. The overlay utility is expanded. Over these mechanics, if we look at the occlusal view of the lower, we're going to have an extrusion of the molars, and the extrusive force or point of application of that force is going to be applied out here. So if you lift up, if you have an extrusive force lifting in this area, you will have that force through the perpendicular distance to the center of resistance of each molar, that force through the perpendicular distance to the center of resistance, which is going to cause the molars to roll or tip lingually. Therefore, the overlay utility must be expanded, and it should be expanded 5 millimeters per side Or if you plug the overlay utility into one of the utility tubes, it would lie 10 millimeters outside the other. That's a significant amount of expansion, and that alone will tend to resist significantly this lingual movement of the molars as the extrusion occurs. Here is the wire sitting passively on the typodont, and as mentioned before it's engaged, there needs to be a significant amount of expansion. So you'll notice I just did that. I'm going to grab the wire here and just expand with my fingers. Now you can see it's quite expanded, quite expanded. Yep. Here you can see the expansion, so that when the wire is placed in the lower right molar, it is significantly outside or buckled to the lower left molar to avoid any constriction of the arch during the mechanical movement. As you may be aware from the live advanced Nathos courses held at the Nathos classroom in Marietta, Georgia, there are significant times where I will be using Class 2 elastics along with the overlay utility arch. The application is meant to do a simultaneous correction of overbite and overjet. Obviously simultaneous meaning at the same time. For this demonstration, I will be using a lower utility arch only. However, depending on the curve of SPI, lower arch, and compensating curve, upper arch, there may be upper and lower utilities used simultaneously. As mentioned, if you are involved in the Advanced Nathos meetings held only live at the Nathos classroom in Marietta, Georgia, you have seen demonstrations of these cases and the incredible efficiency that can be achieved. These mechanics with Class 2 elastics. So the Class 2 elastic would be hooked on the ball hook of the lower molar, and then with the mandible at rest, stretched up to the ball hook of the upper to check the pressure level. This is called a Corex strain gauge, a rather pricey item. This particular gauge is probably somewhere between $250 or nearly $300 these days. And the way it works is that you can see here that there is the lever arm that senses how far things are going. That's 250 grams. I'll reset it. This is 100 plus grams, so you can see how it works. I don't think for orthodontic purposes something this sophisticated is really necessary. So I'm going to stretch the Corex gauge with the mandible at rest. I'm going to move it like this up to the canine, and you can see here that reads out at 175 grams. Let's try that again. I'll reset it. Mandible at rest, and just bring the sensing needle up to the canine. Mandible at rest, and again you can see it's about 175 grams. That would be quite good for the type of mechanics that we're talking about as far as overbite and overjet correction simultaneously.